Lung cancer treatment is undergoing a quiet but meaningful shift, and for some patients, it's turning long, exhausting treatment days into something far more manageable. Medical oncologist Dr. Coral Ala-Zagasti and lung cancer patient and former registered nurse Stephanie Williams join me now with the details. So, doctor, thank you both of you actually so much for joining us today and talking about this important development. But doctor, let's start with you. There's a treatment called Sub-Q. What is it and why does this matter?
Absolutely. Thank you for having us. So Sub-Q stands for subcutaneous administration, and it matters because it's a new modality to provide and to be able to give a treatment for our patients. And so typically in oncology, most of our medications are given through the IV form. And so that is basically having the patients to go to the infusion center, sit in a chair, a nurse has to find the vein. Oftentimes the patients do not have what we call good vein access because they're dehydrated or because they've gone through many different treatments before then. And so by the time that they have to get the IV catheter in, the drug has to be mixed with saline and administered over a few hours, and it takes really a long time for them to sit in that infusion chair and get their treatment. So with Sub-Q, it's really an alternative that we have to that traditional mode of administration. It's a small needle, even way smaller than that injections that patients get with their flu shots, and it's given under the skin. So subcutaneously, meaning anywhere where we have a little bit of fat. So whether that's your arms or your belly or even your thighs, the medication is given, and it's given only throughout a few minutes. So really cutting down that infusion time from hours to just a few minutes.
That's amazing. So how does Sub-Q work once the medication enters the body?
So then once the medication enters the body, because it goes down under the skin, it is absorbed by the fatty cells in the body, and then ultimately it goes into the bloodstream.
Okay, and Stephanie, tell us about your lung cancer diagnosis and how you learned about Sub-Q.
I was diagnosed with lung cancer when I was 37 years old, and a cough led me to getting checked out at my doctor's office. It was very shocking. I ended up getting surgery and then on to chemotherapy. It was during chemotherapy that Sub-Q was brought up to me as an option to receive a medication alongside my chemotherapy treatment. I was familiar with Sub-Q already from my nursing experience. I had given medication Sub-Q, such as insulin, allergy shots, even some blood thinners. So I knew the Sub-Q method of administration had been around for a very long time. That made me more comfortable getting it. And now that I've had Sub-Q during my chemotherapy treatment, I understand how much time it can save patients. And it could cut down on that time you have to spend in a clinical setting, which for someone who's trying not to get sick during treatment is really important.
Definitely. Well, I'm glad you're doing well. And doctor, what real-world problem was Sub-Q designed to solve for lung cancer patients? Was it really just time management, just maybe comfortability?
We say like we're bypassing really the need for the patients to get the IV catheter, and so that's one problem. They don't have to be pricked and prodded, like Stephanie has mentioned as well. Sometimes the patients have to get their port access, and that puts the patient at risk for potential infections, or even having some access through the IV can prone the patients for blood clots. And so we're really having this medication being administered subcutaneously is less invasive for the patients. And not only that, but like you mentioned, it cuts down the infusion hours. So patients, instead of having to be in the chair for hours, they can be there for only a few minutes. A lot of our patients have lives, right? They have families, they have children, they have jobs that they want to maintain. So this gives them the flexibility of going back to their traditional lives and feel like a normal human being. And also having the patients leave the infusion center quicker means that there's more availability for other patients to be seen and to be able to get their treatment as well. And so it really, really just helps in so many different components of patient care.
Wow, yeah, it sounds like a game changer for sure. And Stephanie, before we go, what is your message about Sub-Q for other lung cancer patients?
My message to other lung cancer patients would be to ask your doctor if Sub-Q treatment could be a part of your treatment regimen and care. If you want more information about Sub-Q or all things lung cancer, really, you can go to lcfamerica.org.
All right.
Thank you so much for having us.
Of course, of course. Thank you both so much for joining us. I think this sounds amazing. It's going to help a lot of people. And again, I'm glad you're doing well. So thank you both for joining us. And everyone at home, if you would like to see this interview again, just head to First Coast News Plus.